Maria Dahl has suffered a traumatic spine injury. She is rushed to the hospital. The EMTs work strategically to preserve her delicate state. They strap her down on a backboard so to not further any injury during transit to the ER. Time is of the essence. It's imperative that the surgeon learn everything about the condition of the patient. The trick is to proceed gathering imaging data without adding stress to the injury. Today, patients are often maneuvered onto a rigid cassette or DR panel. Positioning of the detector is forcefully done and rarely accomplished without coming into contact with the patient. In other cases, the patient is brought to a CT or an MRI and maneuvered once again for optimal imaging positioning needs. In any case, handling them for imaging needs seems inevitable, until now. The iCR triage table was designed to serve the needs of traumatic injury patients. Maria is placed directly on the table. Strapped to the backboard, she remains unmoved. It comes fully equipped with an adjustable 17 by 51-inch imaging detector, the first ever of its kind. The portable X-ray source is brought in and the team clears the room for exposure. In seconds, the exposure is taken and the team resumes. The tech processes the full spine image with the onboard touchscreen acquisition station. This non-intrusive imaging system can acquire full spine or regional scans in seconds. While Maria remains still, the team positions the detector and the X-ray source for an AP spine image. The second exposure is taken and the tech processes the two-view study. The table was designed to be a portable low-dose imaging solution. One exposure and a full spine image is accomplished. No image stitching, no problem. It runs on its own battery source and can run for up to 4 hours and acquire up to 200 images before plugging it into the wall. The acquisition software, XC, was carefully designed for purpose, offering direct workflow that simplifies the process with effective acquiring and sending capability. The team did all of this while Maria remained unmoved. Once the tech acquires the images are then sent to Clarity packs for the on-site radiologist and surgeon to consult over the image. The images have been reviewed and strategic measures are already in place in the OR well before Maria arrives. Without knowing it, Maria is already in the best care. The iCR triage table. It's time to think different about traditional X-ray.